My name is Max Topp. I'm at the University Hospital of Wuerzburg in Germany and head of hematology. And I will present today the data of early usage of steroids to prevent cytokine release syndrome and neurotoxicity in patients treated with Yescarta in our clinical trial. The objective of this poster was to determine if by using early steroid intervention if we can prevent the severity of cytokine release syndrome and neurotoxicity in patients treated with CAR T cells with relapsed refractory aggressive lymphomas. The background is in the cohort 1 and 2 of the 01 trial, which led to registration. 33% of the patients developed grade 3 for neurotoxicities and 11% of the patients grade 3 for cytokine release syndromes. Steroids were given to patients if they had grade 3 neurotoxicity or grade 3 cytokine release syndrome, and equally also tocilizumab was entered to those patients also when they had grade 3s. In this trial, if the patient had a grade 1 cytokine release syndrome and the fever was persisting or the symptoms for more than 72 hours, or if the patient developed grade 2 cytokine release syndrome, steroids as well as tocilizumab could be used at a very early intervention. And in the neurotoxicity, steroids could be used even at presentation of grade 1s, and tocilizumab could be given in patients which developed grade 2 neurotoxicity, providing that underlying cytokine release syndrome. Concerning the reduction of cytokine release syndrome and neurotoxicity, was seen in 2 patients out of 21 patients reported here, so reduction from 32% to 10%, and there were no severe cytokine release syndromes grade 4, 5, and 3s observed in this clinical cohort when compared to 10% in the cohort 1 and 2 of the 01 trial. So the other question, of course, is does the early intervention of steroids impact the response? So the objective response rates in cohort 1 and 2 was in the ballpark of 80%. This was almost the same in this cohort 4, with roughly also 81% of patients reaching objective response. This is complete remissions or partial remissions. And also the second question, does this have any impact on T cell expansion, measured on the amount of T cells in peripheral blood on day 7 and day 14? And there was no difference between the cohort 1-2 patients or the ones to the cohort 4 patients. So in summary, it appears that the early intervention of steroids with tocilizumab in patients treated with CAR T cells is benefiting patients in reducing the rate of severe side effects, cytokine release syndrome and neurotoxicity, without having any impact on the efficacy. This is just early data, just on 21 patients, and the full data set will be presented at ASH of 40 patients. We will also present data on a 6-month progression-free survival measured by PET-CT scan on all these 40 patients. Thank you for your attention.